Oh man, where to get started? Okay, why does this cancer dietitian always talk about not taking supplements, that supplements increase cancer risk, and that you should not be seeking out supplements as a way to improve your health or try to reduce cancer risk because it can probably cause more damage? Let me talk all about this because this is such an important topic. So first off, World Cancer Research Fund is a global continuous update project. They provide literally free information. You can go there. Go check out thousands of citations, clear, up-to-date ways on how nutrition and lifestyle can reduce cancer risk or increase cancer risk. And contrary to the internet and social media, that everything causes cancer, right? It's not true. It's actually not true. There's really about 7 to 10 things, nutrition and lifestyle. So like about 7 things, nutrition and lifestyle, that increase cancer risk, and that's it. So there's so many things they're saying that increase cancer risk all the time. Like even just yesterday I was hearing like Nutella's increasing cancer risk. No, it's not. Or your coffee creamers are. No, it's not. Or red dyes are. No, they're not. Or plant oils are. Like, no. Really the only 2 foods actually that increase cancer risk at any consumption are processed meats and alcohol. One other thing that can increase cancer risk, which is lifestyle, is supplements, too many supplements. So let me kind of explain to you what's happening. So your body wants to get a certain amount of macro and micronutrients every day. Macros are carbs, protein, and fat. Micronutrients are all these other like different vitamins, iron, all these different things. Okay, those are micronutrients. Those are some examples of them. So supplements, like let's say you are truly deficient, like for cancer survivors, a lot of times during cancer treatment, they'll be low in iron, or like post-cancer treatment, they'll need supplements with like vitamin D and calcium. These are really normal, okay? And you don't want these levels to be low. You don't want your iron to be low or your vitamin D or calcium. I don't want that to be low for you. However, what ends up happening is most majority of people, unless like you're pregnant, elderly, or really are malnourished, you're going to be able to get in all the micronutrients you need from food alone. That you're going to be able to improve those levels, whatever they are, low iron, magnesium, phosphorus, whatever those low levels are, you're going to be able to improve them with food. In fact, did you know like vitamin C, right? Think about like these vitamin C IV bars and, you get a cold, vitamin C, people are always pushing vitamin C. Did you know like one kiwi, boom, you got enough of the recommended daily intake that you need for vitamin C for the day. Okay? 1 kiwi. You're good. So no, we don't need to be hauling on all this extra vitamin C, but people make you believe that, more is better. No. So more is not better, because what ends up happening is, let's say you get too much vitamin C. Okay, over 200% daily value is usually where like it becomes excessive. Okay, that's like the definition. Over 200% daily value. You don't just like pee out the excess vitamins. Nope. Your body has to process them. Your liver has to process them. So what's going to happen when you have all this excessive vitamin C running through your body? It becomes free radicals. It starts to damage the cell. Okay, so think about like a healthy cell just hanging out like right here, and it gets sprinkled in a little bit of vitamin C, all that it needs in the day from the kiwi, right? Great, happy. Now you have the same cell and you're blasting it with thousands of times of the vitamin C that it normally uses. This cell is now getting hit by all that vitamin C. It becomes damaged. The cell becomes now damaged. It doesn't just like scoot on past like, oh, that cell has enough vitamin C, we're just going to pee out the excess. Nope. Now your body is now fighting against all these excessive supplements that you're taking. Excessive micronutrients. You're literally, excessive supplements, it becomes free radicals. It damages your cells. It puts more work on your liver to digest it out. Your body is not happy having to digest out these 1,000% daily value of micronutrients. More is not better when it comes to supplements. Now, I know why people do it, because people will think that more is better. It's not super satisfying. Like, okay, I just had a kiwi. That's it. I'm good for my vitamin C for the day. Like, yeah, you are. And now you need to go focus on something else, like reducing your alcohol, sleeping better, lowering your stress, moving your body and exercising. Like, I'm sorry, but taking 10, 20, 30 supplements a day is not now better than you. Someone who's over here who's just focusing on more fruits and veggies, getting enough each day, exercising more, reducing their alcohol, they're reducing risk way better than that person who's taking 80 supplements. And those 80 supplements, or however many they're taking, is probably costing them hundreds of dollars each month. It's a waste of money. So unless you have a blood draw from your doctor and they're like, hey, wow, you are low on iron, let's give you a supplement. Then they'll give you a supplement. They will correct it with the supplement. And the doctor will be like, great, your iron's back to normal. You're doing great. Let's take you off that supplement. Let's focus back on food. Like, everybody wants like this crazy, sexy fix to reduce cancer risk or to be so healthy, when actually people aren't eating enough fruits and veggies. People aren't sleeping good enough. You're drinking way too much alcohol. You're not exercising. Nobody's focusing on those things. And they think that just throwing a bunch of supplements down each day is going to fix all that. But it's not. You need to stop drinking so much. You need to start sleeping better. You start moving your body. Okay? Also, other things with supplements that are issues is I'll fortify them with like weird herbals or things like that are not well studied, that are not approved. And again, guess what? Your liver has to process out all these weird herbs. Okay, I've seen so many cancer survivors have wonky ALT, AST liver levels. Like they're all out of whack. The liver's irritated because it's trying to process out all these supplements and herbals that are just not meant to be going through the liver. And then guess what happens? Like a turmeric supplement one time, I had a client on a turmeric supplement. They removed that from their diet and their liver levels went back to normal. So supplements are not the answer. More fruits and veggies, movement, better sleep, lower alcohol. That's the answer, okay? But nobody wants to do that. They think it's so sexy to take all these supplements. It's not a flex when you're like, hey, look at my 30 supplements I take a day. Like, no, you don't need to be doing that. So, I'm so against supplements because they become free radicals and damage your cells. Damaged cells are going to have damaged cells have to be repaired. If you damage too many cells too many times by excess supplements, alcohol, tobacco, these cells aren't going to repair. What happens to damaged cells? Damaged DNA cells become cancer cells eventually. So, let's focus back on the basics first. And if you think you have a micronutrient deficiency, go to your doctor, get a lab draw, see what's going on with it, and then maybe take supplements, correct it, and then get off of them.